Welcome. This technique can really do amazing things for many people out there. The biomechanics of the spine are quite complex, but this technique, the reason why it's so effective is because many people have problems in the upper cervical region because of the fact of forward head posture, poor body mechanics, rounded shoulders, that puts an excessive amount of stress and load on the back part of the ligaments, muscles, tendons, as well as the nerves. But what happens is these particular joints, primarily the atlas, which is the first vertebrae that sits underneath the base of the skull, and the axis, which is the second vertebrae that sits right below the atlas, those two vertebrae are probably the most critical, most important vertebrae of the entire spine because the bottom of the brainstem comes down to those levels. So if there is rotation or misalignment on the bottom of that brainstem affecting nerve roots, you can have numerous different kinds of symptoms, anywhere from dizziness to tinnitus to neck pain to headaches to TMJ to pain into the shoulders, into the arms, even into the legs, because the energy of the brain sits up here. In order for the energy to get through your nervous system, it has to travel down this entire spine. And these nerves that are coming out between the vertebrae, you have 31 pairs of these spinal nerves, and every nerve is going somewhere in the body. Let's look here. Let's look at the complexity of this nervous system. This is the autonomic nervous system. The autonomic nervous system affects the parasympathetic and the sympathetic. The parasympathetic is what allows you to relax. The sympathetic is the fight or flight, causing the stress, the adrenaline. So just to show you that how this system, the top area, the nerve below the skull, okay, just to show you the complexity that when you push the atlas, that first vertebrae, it affects the entire autonomic nervous system. It affects the brain and affects the other areas that affect many different functions of the body. But if you look here, as I push a little lower here, the third vertebrae, it affects here into the mucous membranes in the palate. Here is the fifth vertebrae. This affects into the mouth, into the in the glands, into the throat. It affects down the arm, into the hand, into the fingers. And you can see as I move along, the nerves affect here between the shoulder blades. This goes into the stomach region here. This goes into the liver and here. But every nerve is going somewhere else. Even the nerves in the lower back, how it affects the lower back down the legs, called the sciatic nerve. But actually, look here, it affects the intestine, the small intestine, the urinary tract system, the female-male reproductive system. Everything is working through this nervous system. So that's why you need to understand the anatomy and neurology of what's going on in here, because this potentially is causing a great deal of your symptoms. The technique is very simple, but the most important of this technique is the proper stabilization, because once we stabilize that particular area on the vertebrae, on the atlas, and then on the axis, then we can go ahead and get proper mobility in case there is loss of function or loss of mobility, which is causing loss of function. So the purpose here is to restore movement. When you restore movement, you restore function. So let's do the technique. Right below the skull, that first bone that you feel here is the axis. That's the second bone. Right above it is going to be like a hollow area. That's called the atlas. So what we're going to do is we're going to use our contact point on the tip of our pinky, our fifth digit. You can use your left or right hand, whatever you feel comfortable. I like to use my left. As I turn around, I use my other finger just to feel where I'm at. As I go below the skull, I feel the hollow area. And if I go a little further down, I feel the second vertebrae. That's the ledge, the first bone. I'm going to take the pinky and go right above that ledge. We're going to contact the atlas, the first vertebrae. I'm right over it here, and I'm going to grab the back of my neck like this. After, I'm going to take my other hand, and as I hold that atlas, I'm going to take my hand behind my head, and I'm going to pull it forward. And as I pull it forward, I'm holding onto that atlas. You're going to get a nice stretch. between the base of the skull and the atlas. Good. Then you can come back just to relax it. Look back. Take it again and pull it downwards. Hold it about 7-8 seconds. A little more stretch. Okay. Come back up. Okay. You're going to pull back down a little bit more. About 7-8 seconds. Good. You'll hold that stretch and you'll feel it release. Beautiful. So now we're going to go ahead and contact the axis. I'm going to turn around as we contact below the occipital region. As we go down that first ledge, that first bone is the second vertebrae called the axis. Take your little finger, put it over it, grab below it like this. Take your other hand, and I want you to pull forward as you hold down that second bone. You're going to pull forward about 6-7 seconds. Good. You can come all the way back and release it. Go back and pull forward again. You'll feel a nice release, nice stretch under there as we're increasing that mobility between the atlas and the axis. And one more time, hold on to that second vertebrae, put pressure in it. Just subtle stretch, not too hard. Good. And then release. That technique will really make a huge difference. This is an area that very few people pay attention to, but because the area is such a critical area, such an important area, by restoring mobility in there, and again, by doing this gently, this can really release a lot of that area, increase nerve supply, and get you feeling a whole lot healthier. I ask you to share your comments below as hundreds, potentially thousands of people are going to read this. I ask you to share this video with others, subscribe, and most important, make it a great day. I'm Dr. Alan Mandell.